Hello everyone, and welcome to this audio podcast. This audio podcast is part of this audio podcast series, the Labside Archetype Edition, and this is an audio podcast as part of another radio edition under Storm Labside production. This is an audio podcast as part of a Labside Alchemy, and this is an audio podcast as part of a Bostick's Blast. This is a audio podcast. So this audio podcast, this Labside Alchemy audio podcast, will look at an overview, a sort of a quick overview in around some works from 2016, and where this particular works was published in a scientific journal in 2016, and at the same time in 2016 as well. This works this particular works was also presented at a conference, the International Pediatric Nephrology Association, or IPNA conference in 2016. And this works looks at issues in chronic kidney disease terminology. So chronic kidney disease, or CKD, is a long-term condition in which reduced renal function is evident, and or damaged kidneys are unable to filter blood to achieve normal physiology. With a growing aging population, CKD has been identified as a major public health concern. In the UK, it has been evidence that it can cost up to or has been documented as costing 1.2 billion pounds to prevent acute kidney injury, AKI, which results in a higher risk of death than other specific primary health conditions. And owing to increasing prevalence of primary diseases, there is a higher probability or risk of developing CKD, and there are also other factors that have an impact on disease state, including socioeconomic status, age, gender, and ethnicity. And so the aim of this review, or this works, was to explore some of the terminologies and contentions surrounding CKD classification, severity, and identification, and the rationale for having a sixth CKD stage is explored as an alternative to CKD stages 3A and 3B. And in addition, some emphasis on the National Institute of Health and Care Excellence, or or the National Institute for Health and Care Excellence, or NICE guidelines are highlighted, or are also highlighted. So that draws this sort of quick overview to a close. This works or overview will as in the case with other audio podcasts in this series, will be available on social media. Aligned to Storm Labside production. So this has been an audio podcast as part of the Labside Archetype Edition, as part of a Labside Alchemy. This is an audio podcast as part of a Bostick's Blast, and this has been another Storm Labside production. Thank you.